science, not the spin doctors, and the advice of its own experts, and remove lockdowns, restrictions, and mandates. Give Canadians the date. Well, good morning, Calgary, and thanks to my new friend Alexandre for the introduction. It's a pleasure to be here. I was going to thank her in French, and then I remembered that I was in Calgary, and there's not a whole lot of French speakers here, so no worries. You know, one of the things that I wanted to talk about the previous speaker, Chris, about was there is one thing not delivered by a truck. Anybody know what it is? It's a baby. Huh? How do you like that one? Yeah, so think about that. You know, before I'm going to talk today about the so-called safe supply foolishness, but before we get into that, you know, just talking a bit about the carbon tax and the ideological people who drive it forward. You know, Pierre Poilievre has brought forward in the House of Commons just recently an incredible idea that the carbon tax is a tax that all of us pay, which punishes us. It is also a tax that blows a $40 billion hole in the Canadian economy because of the associated costs, the lack of investment in Canada. So you think about that, who but Justin Trudeau could design a tax, and of course his right-hand henchman, Stephen Guilbeault, who could design a tax that would punish the people that pay it and the country that collects it. It's never been heard of in history. So just, you know, mull on that in your heads and the shocking nature thereof. So in the committee that I'm the vice chair of, the Health Committee, the Standing Committee on Health, we have been litigating the opioid crisis now for many, many months. And it's going to continue till at least Christmas time. And, you know, people say, well, why are you still talking about it? Well, 47,000 Canadians have died due to drug overdose, 47,000. And when you think about all of those souls, you know, one of the things that I often think about is none of those folks were born and as they grew started to say, I wish that I could be a drug addict when I grew up. None of them ever thought that. Little Sally or little Johnny always had a dream. And as Alexandre mentioned, you know, I was a family doctor for a very, very long time and had the opportunity to see children, you know, grow from birth all the way into their adulthood, and some of them have done very well, some of them not so well. But I know that none of them ever came into my office and said, I wish I could grow up to be addicted to drugs. So with that in mind, I think that's an important thing that we need to all consider as Canadians to say, how do we help those people? How do we help them? And I don't mean those people in a negative sense, but how do we help people who suffer? And I think Canada is a great and compassionate country, and I think that there's a lot of work to be done, and as a country, we can do that. Alexandre mentioned that one of the things that I did in my career was I was the physician on a chronic pain clinic. My team was absolutely fantastic. There was a psychologist, an occupational therapist, a physiotherapist, and a physician. I could tell you lots of funny stories about that. But that being said, during that particular time, there was a move afoot in medical circles to say that physicians, mainly family physicians, would treat pain until it was gone. Now, that seems strange looking back on it, but that was a truism that existed, is to say that you will, as a practitioner, and not just me, but family doctors mainly, would continue to give folks opioids until their chronic pain was gone. Just a show of hands, how many people here think that's possible? All right, smart group, good, because it ain't. I can tell you that. You know, you can give people absolute bucket loads of opioids, and they will continue to come back for more. And I think there's a couple of things. One is that they get used to the dose that they're on, right? So we all have heard about that. The more you continue to take opioids, your body gets used to how much you're getting, and you need more. And I think the other part of it is that, especially with chronic pain, there is a lot of, I'll use the term psychic pain that comes along with it. It's not just that my knee hurts, but it's also that my life hurts. Perhaps I've lost my job, I've lost my family, my living situation isn't the greatest, et cetera, et cetera. And as I've often said in the chronic pain world, if all you have is your pain and your channel changer, that's very painful. So that's the kind of context that we're looking at. And so when you think about that, we all have heard the story of Purdue Pharma and OxyContin. And it's interesting when you reflect on that, because in the United States, Purdue Pharma has been convicted of supercharging the sales of OxyContin. OxyContin is a very potent synthetic opioid. It's not as potent as Dilaudid or hydromorphone, which we'll talk a bit about later. But it's a very, very potent drug. And so in the very simplest of terms, we know societally that was wrong, right? Everybody, I think, here would agree. They've been convicted in a court of law to say, wow, they put more of that opioid on the street. It affected people's lives negatively. If you haven't watched some of the Netflix series, I would encourage you to watch them. But that being said, how could we, as a Canadian society, then, not all of us, but some of those in society, say that giving people opioids, as many as they would like, for free, could then end the opioid crisis, right? I agree. When you think about it, you're like, wow, that doesn't make any sense. So that being said, that's where we are.
Oh, hi, it's Ezra Levant here in Toronto with an important message because we need your help. Independent journalism in Canada is under attack. Government censors, big tech deplatformers, and the dying legacy media are all working together to maintain exclusive control on the information you receive. They don't want you to hear other voices like ours, and they really don't want you to be informed and to think for yourself. That's why the work we do here at Rebel News is so important. Our on-the-ground reporting, independent news shows, and special content you won't find anywhere else. It's all designed to give you trustworthy information and alternative viewpoints so you can decide for yourself. We don't get government money, and we are not owned by some big global conglomerate. We're funded by people just like you, so please support independent journalism and help us continue our work by subscribing and becoming a Rebel News Plus member today, right here on the page. Go to rebelnewsplus.com. Members get instant access to all of our shows, invitations to exclusive events, and access to our premium content like live event footage and documentaries you won't see anywhere else. Only Rebel News Plus members can join the conversation by participating in the comments section of our new website. That way you can have your say too. More than anything, though, you'll be able to take pride in supporting real, honest journalism, and you'll help our talented team continue to do the work to push back on the establishment. We really can use your help. We need it, in fact. So thank you, and enjoy Rebel News Plus.